Good afternoon. Good afternoon. Can you hear me in the back? Tim, can you hear me? Lisa, can you guys hear me in the back? Everybody good? Good. Good. Why don't we go ahead and get started? You ready, Emma? Good afternoon. On behalf of Barnes-Jewish Hospital and our foundation, I'm pleased to welcome you all to the installation of Dr. Debbie Bennett as the Ronald and Hanna Evans Endowed Chair in Women's Health at Barnes-Jewish Hospital. I'm Dr. John Lynch. I'm the president of Barnes-Jewish Hospital. It's an honor to share this special occasion with all of you, our colleagues, our faculty members, donors for sure, and friends, and especially with Dr. Bennett and your family behind you today. So the Ron and Hanna Evans Endowed Chair in Women's Health was established in 2004. It's actually one of our older chairs, and Ron was very young when we established it. The foundation, it was established to honor your career, Dr. Evans, and the chair was generously supported by many friends and colleagues and board members, as well as Ron and his wife Hanna, who's here today. So why did this chair garner so much support by so many of you in our institutions and our friends and Ron and Hanna? Well, I think the answer was pretty clear, that Ron held more leadership positions at Barnes-Jewish Hospital, BJC, WashU, and probably nationally than anybody else out there. And so just a short list of some of those positions. He was president of both Barnes-Jewish Hospital and St. Louis Children's Hospital. He reminded me that it was actually twice at Children's Hospital. He was the president of Goldfarb School of Nursing. He was a vice chancellor for financial affairs and provided great wisdom to the dean's office over a number of years. And he held countless other national and international leadership positions. But before he stepped into the fun of being a healthcare administrator, a hospital administrator, he was already highly respected, as you all know, as a leader and as a director of the Mallinckrodt Institute of Radiology and the chair of the Department of Radiology, which he held from 1971 to 1999. As the chair of the Department of Radiology, he was the youngest ever appointed to WashU Medicine at 31 years old. I think you beat Dr. Everett maybe by 1 year, so congratulations. By the 1980s, you all know that Ron had expanded Mallinckrodt into one of the largest, but more importantly, one of the most highly respected radiology departments in the world. And throughout his leadership tenure, it was clear that Ron valued two things: really advancing technology, and so many technologies that we use today that are commonplace around the world were co-developed or developed here with partnerships in industry, with many of the faculty members here. So clearly that was an important value for Ron. But I think more importantly, it was the development of leaders in radiology, both clinical, administrative, and otherwise. And there are many, many great examples here in the room today. Ron's leadership was behind, tying us together today was Ron's leadership was behind launching the hospital's first mammography van in the country in 1986. And that is a common model today throughout the country. Hanna also left her stamp on healthcare. She is a 1960 graduate of Barnes School of Nursing and a former nurse at St. Louis Children's Hospital. To help the next generation of healthcare heroes, Hanna and Ron have established an endowed nursing scholarship at Goldfarb through the foundation in Hanna's name. Ron and Hanna, thank you for your exceptional generosity and leadership over many, many decades here and around the world. Because of you and other generous donors, we're thrilled to install Dr. Bennett as the new Ronald and Hanna Evans Endowed Chair in Women's Health. Dr. Bennett is the current chief of breast imaging and is currently on her way to having very, very impressive legacy as she broadens access to personalized breast screening and diagnostic care for more women in St. Louis. Dr. Pamela Woodard, the current chair of radiology, will share more of Dr. Bennett's accomplishments in a couple of minutes. So our partnerships with really everybody in this room, represented by the School of Medicine, Barnes-Jewish Hospital, BJC Healthcare, have and will continue to have an enormous impact on the health status of our community but also literally around the world. The vision and generosity of donors like Ron and Hanna Evans and others who have supported this chair are also essential in improving the health of our community, fueling innovation into the future. And endowed chairs like the one that Dr. Bennett is receiving are among the highest honors that physicians and scientists can receive. Chairholders are nominated by their chair and then must be confirmed by the dean of the School of Medicine. And these chairs represent, of course, generous donor support through the foundation for the hospital's mission of teaching, research, clinical care, and community service. In addition, the chairs give exceptional researchers and clinicians the ability to pursue groundbreaking work that leads to better treatments and better technology. Since this endowed chair was established in 2004, it has impacted so many lives nationally through renowned leaders who have held this chair position. Dr. Bennett, as we've said, is already making her mark on women's health, and we're all excited to see your future accomplishments. Dr. Bennett, congratulations on this well-deserved honor, being named the next Ronald and Hanna Endowed Chair in Women's Health at Barnes-Jewish Hospital. It's also wonderful to see some of your family here tonight to recognize and help celebrate, and they're all dressed up nice. I love the bow tie. So Mike, Cameron, and Madeline, welcome, and we're so glad you're here. Now, please welcome Ron and Hanna Evans up to the podium for a couple of comments.
Thank you, John. Hanna and I are happy to join you today and to celebrate and recognize Debbie Bennett, who will maximize the opportunities this chair brings to expand and improve women's health care. As a young doctor, I had numerous mentors who encouraged and inspired me, Bill Danforth among them. There was a major factor in the path my career took me, from research to physician to administrator and everything in between. Every step of the way, my goal was to help patients. It still is, which is why Hanna and I have supported this chair. And I want to warn you that as you get older, you often need support to get out of the chair. I chose the radiology field because I enjoyed clinical work and the detective work of the diagnostic process. A lot of people warned me. They assumed I was going to be in internal medicine and be a researcher, but I didn't like I much enjoyed the diagnostic process, which gave me a choice of either radiology or pathology. And I thought radiology was closer to the action. But in the days in the 60s when I did this, everybody thought of radiology as in a dark room, which was to some extent true. But then talk about being lucky, along came CT scanning, MRI scanning, PET, and ultrasound that got you right into the business right away. So it all worked. Companies came to Mallinckrodt, especially Siemens, to not only try out new equipment, but develop things. In fact, a guy that was a key part that many will remember, Mike Terpagosian, was really the key developer of PET machines here, along with others. I became the head of the department at the age of 31, almost 30 years. During that time, the accomplishments I was most proud of were the people I trained. In fact, all three chairs at Mallinckrodt after I left were people I trained or hired. Pam, Gil Yost, and Rich Wall. In fact, as I look back, one of my reasons for success was I really wanted to encourage young people to come and be developed. And so I actually had a rule in the department, which is I did not want to stop anybody from leaving. In fact, leaving to a newer post gave us friends in the world elsewhere and also allowed me for a position to recruit somebody to. The rule was, and this goes back, the radiologists will understand this, the rule was when you left to go somewhere else, it should be a good enough place that, number one, you can only take one faculty member with you. And number two, don't take the teaching file. Because in those days, there was not electronic radiology. The teaching file was what you used for students and stuff. Yep. I'm excited to what's next for Dr. Bennett's passion and women's health. She's a pioneer. That's why we're proud to support her work as she ensures access to personalized breast screening and diagnostic care with the help of nurse navigators. Her research that may lead to new ways to detect breast cancer earlier, it's exciting what she's doing, and we'll hear about it. We offer our congratulations to Dr. Bennett and look forward to seeing more of the impact she's going to do. I also want to thank Debbie. It's just great that not only do you have this important personal and professional life, but you can see from behind you that you've got a great family life as well that we got to meet, including some very active young lady that's right there. I'm sure you were probably like that when you were that age. So it's my now pleasure to introduce Dr. David Perlmutter, Dean of the Washington School and Executive Vice Chancellor for Medical Affairs. Hi, Dr.
Thanks, Ron. I am here representing WashU Medicine to recognize Dr. Debbie Bennett from our Department of Radiology, to express our gratitude to Ron and Hanna for many years of support for BJH and Washington University, and to also thank the BJH Foundation for helping us to support the exceptional talent that comes to work in our hospitals and our research and teaching programs. Every day on this campus, we have faculty and staff and trainees carrying out the mission. And when I mean mission, I mean taking care of patients who need us and taking care of them to the best of our abilities with the state-of-art knowledge and technology. But what makes this institution even more special is we are not satisfied for the best of today. We go back into our laboratories to find better solutions because we are dedicated to the philosophy that we can always improve and that those improvements can lead to better lives and better health. Dr. Debbie Bennett is a shining example of this philosophy. I have seen firsthand how she takes care of her patients who come to her for breast imaging. Most of those patients are terrified, and sometimes, too many times, are waiting for days for results of their mammograms. And sometimes they find out that they have to come back for additional imaging. It is an incredibly anxiety-provoking part of their lives, and Debbie is using all of her ingenuity and compassion to make those moments less anxious. At the same time as she is caring for her patients, and I mean deeply caring for them, she is working with a team of investigators on improving the predictive value of mammography through the use of artificial intelligence. And this exciting new technology has recently been given breakthrough status by the FDA. We have made progress in identifying breast cancer as early as possible, but we still lack the capability of distinguishing which breast cancer will progress and which will not. And so we know that overdiagnosis and overtreatment are major areas to work on in this area of medicine. These are just some of the reasons we are recognizing Dr. Debbie Bennett with this endowed professorship. Debbie, we are so happy to celebrate this milestone with you today, and thanks again to Ron and Hanna Evans for your dedication to our mission all of these many years. It is now my pleasure to introduce Dr. Pamela Woodard, the Elizabeth E. Mallinckrodt Professor, Head of the Department of Radiology and Director of the Mallinckrodt Institute of Radiology of WashU Medicine, to give the formal academic introduction. Pam?
Well, thank you so much, David. This is so exciting to see everyone here today. What a wonderful audience. I mean, This really, truly warms my heart to see everyone here in honor of Debbie. You know, Debbie is really a groundbreaking leader in the pursuit of breast health, and is truly deserving of the Ronald and Hanna Evans Endowed Chair in Women's Health. And in a minute, I'm going to be highlighting her accomplishments, but briefly before I begin, I'd like to discuss, I'd like to acknowledge Dr. Barbara Monsees, who is the inaugural holder of this. Yeah, she's the inaugural holder of this endowed chair, and former chief of breast imaging and a pioneer in breast imaging, and responsible for bringing in breast imaging and the breast mammovan in the 1980s. So you were so instrumental and mentor to many, and kind of the foundation that we move forward from. So very excited to have you here. Yeah, but returning to Dr. Bennett, and she, but really she's a key member of the Siteman Cancer Center's Breast Cancer Center Engagement Group. She's a pioneer in personalized breast health at WashU Medicine and BJC Healthcare. She has a tremendous passion, and this passion is to ensure that every woman has access to breast care, every woman in St. Louis. She's making tremendous inroads in this regard, and I do trust that with this chair, she'll have the opportunity to make even additional inroads. So very excited for all of that. So her influence is expansive. She oversees breast health services at Barnes Jewish Hospital, and then also multiple other Siteman Cancer Center hospitals in the community, BJC hospitals, including Barnes West County, Barnes Jewish, St. Peter's, and Christian Hospital. And she is a true leader. She is appointed a director of breast imaging, breast health at each of those hospitals, who report to her and work with the hospital administration to hire nurse navigators to guide breast cancer patients through their diagnoses. As Dr. Perlmutter mentioned, this is often a very trying time for women who find out that they have an abnormality, and having those breast navigators is very helpful in guiding them through that process. She has significantly expanded diagnostic breast imaging services throughout the BJC enterprise. Specifically, I want to highlight Christian Hospital, where there are many underserved women. And this hospital now has a dedicated breast MRI service for women. And most impressively, over the last 2 years, breast imaging has increased by 1,000 scans. I think we were talking about this, Debbie. 1,000 a year for the last 2 years, and is now well over 9,000. Nearly 10,000 women get their screening examinations at Christian Hospital. The other thing too is that with this, the breast cancer detection rate has doubled over this time. So, we're finding the breast cancers and women are coming. The women are actually coming to have their cancers detected. So I think this is just so rewarding, and it's to your efforts that have resulted in this. So her impact and her expertise are invaluable. She collaborates with our breast surgeons, our medical oncologists, and our radiation oncologists. She's a Siteman Health Equity Fellow and is committed to preventing cancer. Another role that she has. She'll soon tell us a little bit more about her research. She has been a key person in the research projects in artificial intelligence, as mentioned by Dr. Perlmutter, with Drs. Graham Kolditz, Joy Zhang, and Amelia Gastinuti, who's also in the audience. This work, a lot of this work has been published. So very exciting as we start to move, throughout. We're basically forging history. We're moving forward with new techniques that can help women. So she'll be sharing more of that exciting research with us in a few moments. She is also a fantastic teacher. She is a mentor to faculty and to medical students, to residents, to fellows. Many who have also chosen breast imaging as their career. We have a few in the audience who have been here at Washington University. She graduated magna cum laude from Harvard and completed an internship at Vanderbilt Medical Center, served it as chief resident, and completed her breast fellowship at Massachusetts General Hospital, and then joined the faculty at St. Louis University School of Medicine. We won't hold you anything against you for that. But she was the breast director there, and had the foresight to come over and to work with us in 2020. And so very delighted to have her lead our program, really taking the program from, I think it was 5 radiologists when you started, to now over 12. So amazing growth in that section. She is respected among her peers, beloved by her patients, an exceptional leader, clinician, and educator whose efforts have resulted in the best breast health care for women throughout St. Louis. So I am so pleased that Dr. Bennett is being installed today as the Ronald and Hanna Evans Endowed Chair for Women's Health at the Foundation for Barnes-Jewish Hospital. So I'd like to give my congratulations to Debbie Bennett on this well-deserved honor.
Should wear it.
Oh, yes.
Yeah.
Oh.
Thank you, everybody, for being here. What a tremendous honor for me, and really seeing everybody here. I could not have picked a better title for the talk, which is about building communities through breast imaging. This honor, even though I'm the one standing up here with a medal today, really is for all of us, because it has taken the entire community of people here to get all of us to this point today. So I will be giving some specific thank yous throughout my talk to some of you, but please know that everybody has had their own role in getting me to this point today. Of course, I want to start by extending my own deepest thanks and gratitude to Dr. Ron and Hanna Evans. This is an image from one of the foundation magazines where the title was Connected by Kindness, Generosity, and Hope. And I could not imagine a better tagline for the gift that they have given and that they continue to give, both through Dr. Evans's leadership and commitments to the Mallinckrodt Institute of Radiology, and also through the legacy of this gift. Thank you both. I want to start just by talking a little bit about the path and the people that have brought me here today. Pam says that's the most interesting part of these talks, so we'll start with that, and then I'll tell you a little bit about the work that we've been doing. One thing to mention, Mike, my husband, and I had the opportunity to have dinner with Ron and Hanna a couple months ago. And I asked Ron during a lull in the conversation, I said, do you want to hear a little bit about the work that we're doing? Assuming, that he would be interested in knowing, what are we going to do with this gift that's being given? And he said, No, that's okay. I trust you. And it's that gift that is so remarkable. And so I stand here today with my commitment to you that we will steward your gift and use it to the best of your ability. And I appreciate your trust that you've placed in me. Thank you. So I grew up in the DC suburbs. I thought this was a great opportunity to showcase some really embarrassing photos of myself as a child. You know, a child of the times for sure. We'll get to the thank yous at the very end, but this is where I started. I also wanted to talk about my first mentor, which was my high school science teacher. I went to public school in Northern Virginia, and the first person that even introduced the idea of an investigator-initiated trial was my high school science teacher. And I use that as a reminder that you can instill and inspire in people at a very young age the importance of curiosity and learning and science, and that is what Dr. Kammer did. I also thought this was interesting because out of this lab, this was one class from our freshman year high school science, there were 4 WashU physicians in this one class, which is crazy. We had a pediatric neurologist, an orthopedic surgeon, an anesthesiologist, and me that all ended up here. So this idea of the community that we live in is also very small, even though it might be geographically far-flung. And that was my introduction to science. I went to Princeton for my undergraduate studies. I did start in molecular biology, that's what my degree was in, and learned how to do proper lab research, but the most important thing that came out of it was meeting Mike. So for those of you For those of you that are not from St. Louis, the St. Louis thing is to ask where somebody went to high school. And so having not grown up here myself, nobody cares where I went to high school. But people always want to know where Mike went to high school. And this is my chance to brag on him. He not only went to Parkway West, but he was the valedictorian from Parkway West. And the rest was all downhill from there. No, I'm kidding. I'm kidding. The rest of his career has also been incredible. He's a gastroenterologist here on the practice as well. The next 7 years was spent as a trailing spouse. And for those of you that have lived this, you know how difficult this is. And when I went back to put this talk together, it was kind of incredible, actually, that we spent 7 years doing this. So we spent 7 years essentially leapfrogging across the country, just trying to be in the same place for more than a weekend at a time. I went to HMS for medical school. He went to a lab at Columbia in New York City. If anybody has ever ridden the Chinatown bus, you understand the pain that is doing long distance. We did this for a lot of years. He eventually decided to go to medical school too, and that's how I ended up doing a year of research and my internship at Vandy, where Mike was getting his medical degree. And during that time, I met my first radiology mentors, and they were the ones that really ignited the spark for me. Kit Schaefer was an HMS faculty member. She's now at Boston Medical Center, an incredible educator for anybody who's in the field. You probably know her. And Art Fleischer at Vanderbilt was my research mentor at that time. He's an expert in women's health ultrasound, so both in the OB-GYN sphere and also in breast. And it's interesting, I never knew at that time that I would be looking at breast cancer models, 15 years down the road. But even when I was a medical student, my first radiology research paper was on looking at microbubble use, so contrast-enhanced ultrasound in a breast cancer model. One thing that is a theme between these two people is that they believed in the ability of even young people to do things. And so, Ron, you were talking about the teaching file. I mean, that was, even when I was a medical student, that was how we learned in our radiology rotation. Somebody sat you down with the teaching file. You went through the teaching file, and when you were done, they sent you home for the day. Kit Schaefer sat you down at an actual view box, a computer with real patient images, and said, here, look at these 3 patients and tell me when you're done and tell me what you think. And that made all of the difference for me in deciding to be a radiologist. I think for a lot of people, when their experience coming through is just watching other people do something, you don't feel the same excitement about the detective work and the art of trying to figure out diagnostically what's going on with the patient. And she really understood that you had to do it in order to feel that, and I'm eternally grateful for that. Same thing with Dr. Fleischer. He basically said, here's a project. Can you figure out how to answer this question? And we did, and it was amazing. The other thing I learned in his lab is that I did not want to do mouse-based lab work ever again. The sacrificing of the mice, if you've never done it, it's terrible. I much prefer the research that we're doing now. I did my residency, as Dr. Woodard said, at Mass General Hospital, where I met 3 phenomenal radiologists. Teresa McLeod, for those of you that don't know her, has been the residency director at MGH for almost 50 years. She was the first female professor at MGH, which a title that she got in 1993, which is also kind of astounding to think about. And she has trained generations of radiologists. And I don't use that term loosely. Really, I think she's trained multiple generations of radiologists. Bethany Neal, who is here today. Bethany was my chief resident when I was a first-year resident. I was telling, she was kind enough to give a talk to our trainees today, and I was telling them, that's how she will forever live in my mind as my chief resident. And she has continued to be a source of wisdom and inspiration throughout the last 15 years. When I have a difficult decision to make, I ask myself, WWBD. What would Bethany do? And the answer has not steered me wrong yet. So Bethany, thank you for being here today. Phoebe Freer, former Mallinckrodt trainee, some of you may recognize her, was one of my attendings in the breast section at MGH as well. She really wanted to be here, but couldn't be for family reasons. Phoebe and Bethany together were the reasons that I went into breast imaging. I saw the way that they actually interacted with people and patients, and I said to myself, that is why I went into medicine. And that, I think, is what connects a lot of the people that have chosen breast imaging in this room also, is that connection that you feel with your patients and with the colleagues and the communities that we've built. The other reason I'm grateful to Phoebe, in addition to choosing the direction of my career, is that she got me my first job here in St. Louis. So Mike has influenced my life in, a lot of ways, but one of the ways that is most relevant is that he matched here at WashU for GI fellowship back in 2014, and it was decided we were not doing the trailing spouse thing anymore. I was moving to St. Louis too. I did want to come to WashU, for the record. But for those of you that were around in 2014, you might also remember that it was an entirely different job market than it is today. WashU was on a hiring freeze, and Phoebe Freer got on the phone to Jeff Brown, also former Mallinckrodt faculty member, then chair at SLU of the Department of Radiology, and said, can you please make a job for this person? And he did. And I am so thankful, because not only did it provide me the chance to be with Mike on a more than weekend basis, but also it provided me the chance to be part of the community here. These are my colleagues at SLU, and they're here with me today, which I so appreciate. Kathy Loudermilk, Laura Villadello, Christy Dougherty, and me. So I want to thank Christy and Kathy. These two ladies had been doing community breast radiology, taking care of the people in our community for years before I got here. Christy started the breast center at SLU. Kathy did it at St. Mary's in Richmond Heights, and they have just been quietly doing their thing for years without any expectation of recognition. These are the two people that taught me what it meant to be a professional. I mean, this was my first job out of fellowship, and you guys were the best role models. Not only did you teach me what it meant to be a professional, but you also taught me what it means to really put down roots in a community, which when you're a resident, a fellow, a trainee, like, you're just spinning your wheels looking for the next thing always. And these ladies showed what it means to just be in the right place at the right time and be there. So thank you guys. The other thing they taught me for the radiologists in the room is to love a clean list. So these ladies can read down any list to 0 before you've even had a chance to take a sip of coffee, which is something that is very much appreciated. And when Laura joined our practice a couple of years later, she and her husband Mike, who are also here with us today, taught us the value of long-lasting friendship. So thank you. Okay. I did have the opportunity come up to join WashU, and I really wanted to have a bigger platform and have a bigger impact on more patients in our community. And so when Dr. Wall, who was the former chair here, asked if I'd like to join, I said yes. Dr. Appleton, who many of you know also, who was the former section chief here, was instrumental in helping me get here and also in supporting me throughout the transition. Bob McKinstry, who's one of our vice chairs, also took on the role of interim section chief on top of all of his many other duties that he was doing. And I appreciate the fact that he held the section together while we were figuring out a way for me to make the move. Tim Wheely, de facto interim section chief. Thank you for all of your advice during the transition. These were the 4 radiologists who were here at the time. I am truly grateful for you guys having the faith in me and the patience throughout the process to stay during the transition, because it gave us a core group of people to build from. Barb. This truly is the house that Barbara built, and I'm doing my best not to let it go downhill. I want to tell the story of probably one of the first times that we met, and you might not remember this, but it was in the St. Louis airport. We were on the way to RSNA. I think I was with Laura or Kathy, one of these ladies here, and I would whisper to them, "That's Barb Monzi's over there." And it was Southwest, you know, you don't have assigned seats. And I was like, oh my gosh, I cannot make eye contact with her as I'm boarding this plane because I don't know what to say. I think the term they use these days is fangirling. But you caught my eye as I was boarding. You said, "Debbie, sit down." I was like, oh my God, she knows my name. Like, this is crazy. And you might not remember the conversation, but we ended up talking about how to improve the quality of breast imaging in the community. And that conversation has really guided me throughout the last 10 years to always bring it back to the person, the people that we're trying to serve. And that has not led me in the wrong direction yet. So I don't know if you took a tour up to our offices today, but this is the view from my desk. Barb looks at me from my desk. Every day, you're angled ever just right so that you can keep an eye on me and make sure that I'm doing the right thing by all of our patients in this role. So thank you for building all of this. None of this would be here without you. Okay, so when I started, I think somebody mentioned it was 2020. You guys remember what 2020 was like? Probably we try not to remember what 2020 was like. But in addition to starting with this core group of 4 radiologists, I also started in the middle of the pandemic. And it was a year and a half before I saw the lower half of any of the technologists' faces. It was really this crazy thing when the masks came off a year and a half later to realize what people actually looked like. Because in my mind, I had created, a picture, and then there was reality. So that was where we started. I made it my mission to build from this group and build on the core values of a culture of trust, a culture of cultivating people's individual excellences, and together making a place where people wanted to be. And And this is the result 5 years later. So our team has grown to 12 radiologists in the breast section. We got a couple radiologists that we share with other sections. We have 5 fellows this year. We have a team of 4 amazing nurses. It really has been a wonderful 5 years. So thank you guys. I want to highlight what the impact of that growth has been, because it's one thing to say, okay, we have more people, great, but what are we doing with those people? And the answer is that we're providing care for more people in our community. So the overall growth compared with 2020 coming out of the pandemic to last year has been 30% more patients screened a year and almost 50% more diagnostic patients seen. And that really has an impact on each individual patient. At the same time that we've been seeing more patients, we've also been seeing them quicker. And as Dean Perlmutter mentioned, if you've ever had to wait for a test result yourself, it's terrible. You just want to know immediately what the answer is. Coming out of the pandemic when a lot of the non-urgent services were paused, I think, even though we didn't really have a way to track it, I think that we started with the wait time between an abnormal screening mammogram and the diagnostic evaluation of almost 3 months, which is sort of unconscionable to even say out loud at this point. And we didn't have a way to know. We didn't have a way to really track that. We've done a lot of work on that, and you can see what the result is. Our wait times now for Barnes are down to less than 10 days, getting there for Barnes West, and Christian Hospital is improving too, and we'll talk a little bit about the Christian Hospital mission. One of the reasons that we decided we wanted to improve our access to care in North County was because we wanted to meet patients where they were. So understanding that there are a lot of patients that live in North City and North County that might love to come to Barnes for their care to access the subspecialty care that we have here, but that it might not always be possible for them. One of the things to highlight is that, for those of you that don't live here, North City and North County reflect a part of our community that is typically medically underserved. So there's a lower, generally, socioeconomic status of our people that live there, and a higher Black population as well. And the problem is, for our Black patients, the breast cancer mortality is significantly higher than it is for our white patients. So they're much more likely to die of breast cancer. Part of that is the biology of the cancers that they get, but part of it is also the access to care and the lack of access to screening. We see it in the last 5 years. We have increased the number of patients that are being screened here to almost 15,000 from previously 11,000. And the impact of that, as Dr. Woodard mentioned, is that we're diagnosing cancers there at a much earlier stage. So the number of cancers that are being found on screening is twice as high as it was previously. Part of that is getting patients in, and part of it is also providing access of subspecialty breast radiology. A lot of this work has been done with the help of Kathy Weilbacher, who's one of our medical oncologists and champions of our breast cancer equity group. Tabassum Ahmad is one of our breast radiologists who's at Christian right now, who has also taken on the direction of the site and has really made her mark. One of the other ways that we're making sure that we get out in the community is through our outreach events. So we're trying to reach people even outside the clinic, because there are a lot of people who are too nervous or too afraid about the idea of coming in to even hear about breast cancer, even have the chance to talk to one of us. And so we're making a concerted effort to be in the community at community events. This is Jamie Mannix, one of my faculty members, doing an excellent interview on cancer mortality rates. And as more people get involved, we're able to multiply our message. One of the things that somebody mentioned is that the beauty of being at WashU is not just the ability to provide excellent clinical care, but the ability to push the envelope and ask, can we be doing this better? And so I want to spend just a few minutes talking about highlighting 2 projects on this question, can we be doing it better? So one of the questions is, why do we put so much emphasis on screening mammography? Why are we out in the community banging the drum, talking about increasing screening mammography rates? Well, this is why we think it's important. It's because if you can find a cancer on a screening mammogram when it's really small, then it's much more likely that your lymph nodes are going to be normal and that it won't have spread anywhere else in your body. And those are cancers that typically are curable. If you find a cancer by the time it presents as a mass that somebody can feel, it's a very different story. So this is an example. You can see a much larger mass and abnormal lymph nodes, where this has also spread beyond the lymph nodes to other parts of the body. We thought we had answered this question a long time ago about, does screening mammography save lives? We think that the answer is a definitive yes. That is why we do what we do. The best trials that we have are randomized controlled trials from decades ago that show an impact of 20 to 40% reduction in your likelihood of dying from breast cancer. The problem is that the controversy continues to the point where some European countries are even saying, we don't want to have organized screening anymore. It's not about screening, it's about better treatment. And so to answer the question recently, people have turned to models, but these models are very, very complicated and don't really get at the question of, in true practice, what is happening when people get screening detected cancers versus not. And that gap is what we're trying to address. So one of the things that my partners and I did during the COVID pause was to go through 5,000 patient charts and manually look at what was the method of detection, because this is the way that we think we can answer the question of, in this country, what is the impact of screening mammography? And so we pulled out the method of detection from all of those patient charts, and the answer is not surprising. The answer is what we would expect. The screen-detected cancers are less aggressive, less likely to require advanced treatment, etc. But this is the data that we need to be collecting on a national scale so that we understand truly what is the impact of screening. This is data that's collected in a lot of European countries that have organized screening programs, but it is not collected in this country. So we took what was a retrospective trial, and we asked the question, well, can you do this prospectively without having 3 radiologists go back through 5,000 patient charts? Is it possible for us to ever collect this information in this country? We did a prospective trial here looking at whether it could be done. We did it as a multi-center site with Duke and Seattle and Penn, and the answer was yes. It turns out that everybody can agree on what a prospective assignment is for method of detection. It can be abstracted by our tumor registrars, who are the people that are responsible for tracking all of the outcomes of breast cancer. And all of a sudden, you can have a data set where the method of cancer detection is actually linked to outcomes for patients that are diagnosed with breast cancer. We took it a step further than that. We got it endorsed by the American College of Radiology so that it is an official part of breast cancer reporting. We went to our technology colleagues and got it added to the infrastructure for EPIC, NAGView, other mammography reporting systems. And so now the infrastructure is there so that every breast radiologist in the country can be reporting on this. And hopefully, in a few years, we will start having an answer for us in this country to the question of what is the real impact of it. The other place that we got it added was to the BI-RADS. So I was able to participate as an author on the latest version of the BI-RADS for all the breast radiologists in the room. You know, this is the Bible of breast imaging. It was such an opportunity for me to be able to do that. And as part of the auditing chapter, one of the things we were able to do was bring this concept of method of detection to the breast imaging Bible. And so it's a joke. We're all waiting for the next version to come out. It has theoretically been finalized for a couple years, but when it comes out, it will be part of the next version and should be very impactful. The other research that I want to highlight, as some of our previous speakers have alluded to, is some collaborative research that we're doing with Graham Polditz and Joy Jang, who are from the Department of Surgery. This is really exciting because it's looking at this question about risk prediction. So for those of you that are not in breast imaging, a very popular topic of research in general is, can we predict who's going to get breast cancer and who's not, and not just on a lifetime scale, but on a much smaller time scale, so that you know when the intensive additional screening needs to be done, and not over the course of an entire lifetime. So they started with a very simple algorithm, at least it seems simple on the outside, it's a black box, honestly, what they're doing, that just looked at, if you looked at a person's breast that developed cancer versus a person's breast that does not develop cancer, and you look at the change in density, not any other factors, but just density over time and quantify that, can you predict who's going to develop breast cancer? And the answer, surprisingly, was yes. It turns out that there is an expected decrease in how quickly density decreases in the unaffected breast versus in breasts that subsequently develop breast cancer. And this is years before somebody actually gets diagnosed with breast cancer. And so the exciting thing about this is that they could build on this change in density to incorporate a more robust model for risk prediction. This is a busy table, but what I'll tell you is that this is what we currently are using. The Tyrer-Cuzick model is a demographic-based risk assessment model. It asks the patient a bunch of questions about, like, how old were you when you had your first period? How many family members do you have who've had breast cancer, et cetera? And if you look at the accuracy of it, it is not very high. An AUC of 0.56 is basically not much better than a flip of a coin. And that is the current standard of care for how we decide who is at higher risk of breast cancer and who needs intensive screening and who doesn't. If you look at the AUCs, which is the accuracy of the model that Graham and Joy have developed and that I've worked with them to bring to clinical practice, you can see how much better an image-based model is than a simple demographics-based model is. And it makes sense, because in many ways the mammogram is the final common pathway. It encompasses all of the information that we're asking from the questionnaires, and it shows it to us in a way that currently is just below the threshold of what the human eye can see. And the other interesting thing is that if you even add back in other clinical risk factors to the image-based model, you don't get an improvement in accuracy, which again suggests that all of the information that we need is already in. And the exciting thing is that, as somebody mentioned, the software recently received FDA breakthrough device designation, which puts it on the fast track to be getting FDA approval for use. We're planning a clinical trial here looking at whether we can now start to intervene on this question about method of detection. Can we move the needle from people being detected clinically to people being detected from screening or supplemental screening by identifying that subset of patients that would most benefit from intensive surveillance and having them screened with MRI in addition to mammography. So that's what we've done in the last 5 years. It's been a busy 5 years. I want to highlight some of the things that we're looking forward to in the next 5 years. Heather Garrett has a cryoablation trial. Cryoablation is a non-surgical way of treating breast cancer. How amazing would it be if you didn't have to go to surgery to have your breast cancer treated? You could have your treatment done the same way as your biopsy. She's enrolling patients in a randomized controlled trial for that. Pink and Pearl, Michelle Lee, is leading a combined breast cancer and lung cancer screening program. So building on the infrastructure that we already have for breast cancer screening and trying to find the patients that would also benefit from lung cancer screening at the same time, which would, again, significantly improve mortality. Breast cancer navigation, our nurse supervisor, Jennifer Stump, is trying to work together to build a model where every patient diagnosed with breast cancer has a person. So, you know, when something happens to us, a loved one, what's the first thing we do? We get out our phones, we figure out who we can email or text to help us figure out the answers that we need. How amazing if every person had somebody that could be that person for them. Amelia Gastuniati is doing a lot of research on AI and risk prediction, again, trying to figure out how can we harness all of the information that's contained on the mammogram image and use that appropriately. Tunji Toriola. We're working collaboratively with him on breast cancer prevention trials. Probably not something that Pam wants to hear, but what if you could put us all out of a job and breast cancer didn't even exist anymore? That is the goal that we are all working towards. So I want to close with just a few thank yous. First of all, of course, to thank Ron and Hanna again for this tremendous gift. To thank some of the other members of our community. Pam Woodard, our department chair. She's a harbor in the storm. She said that her coach told her that one of her abilities is to weather things out, and it's true. I mean, she has been really a North Star for us through some very uncertain times, and you have the full faith and trust of the department behind you. Thank you. Perlmutter, thank you for your leadership of WashU Medicine. I know that it is not easy to balance all of the competing missions, and you have set us up for success in all three, which we appreciate. Dr. Lynch, thank you for providing the clinical care basis for everything that we do. We could not provide care to any patient without the leadership that you provide. I also want to thank David Bruns, who's the executive director of the foundation, for this gift. Emma Bayless is the person that actually put all of this together. Emma has been incredibly patient with me as I figured out what I was supposed to do. Thank you, Emma, for this celebration. And Kristen, thank you. Where's Kristen? Thank you for the introduction to the Evanses and for all of your help as well. And in the last couple minutes, just to end with more thank yous, this is our team. We have some of our team members from Barnes West Christian Hospital. A lot of them are in the back row up there. I don't know why you guys all decided to sit in the back, but there they are. These are the people that are providing care in the face of breast imaging to our patients on a daily basis. We get so many compliments about the way that they treat patients, and it is well deserved. Jordan Foy and Stephanie White, who are our Siteman leaders, thank you guys for being my partners in crime. I feel like we talk every day, almost every day, to make sure that we're in lockstep. These are the people that actually translate all of the crazy ideas that we have into reality. So thank you. And all of our wonderful technologists. I do also want to thank, I think I added in at the last minute a slide about our surgical oncology colleagues, Julie Morgan Taylor, who's here with us today, Rebecca Aft, I think I saw her also. We work so closely with our surgeons, also our pathologists, medical oncologists, radiation oncologists. It really is a team sport, and I'm so thankful for their partnership. Okay, my section. You guys are the reason that I keep showing up to work every day. I feel like a proud parent at this point in our section. The successes of each person in the section are my successes, and that really makes it so fun to see everybody finding their way and blossoming. Ping, Sanjeev, and Steve are three of my co-chiefs in the Department of Radiology. They have this continuous chatter that is so funny and provides like a much needed line of humor and support throughout the day. I want to thank two of my friends from college who made the trip here from DC and Texas, Carol and Matt. They make orange look good. Don't know why anybody would think orange is not flattering. Okay, and to finish up, Becky Britt. Nobody can take her as their nanny. She's our nanny. Becky is the reason that I can come to work every day. Every day that I work, Becky works an hour longer than I do. And she's the reason that I can give all of myself to work, is because I know that my kids are fine when they're at home with Becky. So thank you. Carol and Alan are Mike's parents. They couldn't be here today due to a health emergency, but I know they're here with us in spirit. They have welcomed me like their own child to St. Louis, and we love them, Nana and Pa. My parents, who traveled here today, Jim and Sherry Lee. for instilling the values of hard work, education, having a lot of fun, as you can see, and courage to do things that might be out of your comfort zone or might be uncomfortable. Thank you. Okay, finally, my family. Mike, we've grown up together. I met Mike when I was 17, which is crazy. First week of college, and here we are. We have been through a lot. I think, like, if there's a way to intertwine DNA, I'm pretty sure that our DNA is intertwined. He has been an incredible partner and support, and there is no way that I would be here without you. And Cameron, Maddie, this is the moment you guys have been waiting for. Your pictures are up here. This is the reason to do what we do, which is for them, for their tomorrow. I love you guys. You guys are the best kids. It warms my heart when I come home. Aww. And someday, you guys can be breast radiologists too, because it seems like you have to clone yourself to be able to recruit these days. So thank you guys so much for everything. This is truly an honor, and as I said, it's an honor that belongs to all of us. Thank you.